So I'm a medical doctor. I trained as a physician in India. When you grow up, and especially in countries like India, the whole vision of health is very biomedical. So it's all about bacteria, virus, medicine, germs, medicines. But it was only when I started studying public health I realized that medicine itself had very little to do with health. Medicine is all about illness. So once I began to appreciate the social and economic and political determinants of health, and that how you live, where you live, had much more impact on your health than medicines and hospitals itself, that completely changed the way I looked at health. When I first went to Ethiopia to work, it was more as an adventure. Was interested in, had never worked in Africa before, but what I saw there completely changed my view about how to be a health professional. It completely, what was initially meant to be a year in Africa ended up being 25 years in humanitarian health. I think it's a very, these are the, you work with some of the most vulnerable people in the world, and as a doctor and as a health worker, you're able to be part of much bigger changes than you would if you were a doctor in Delhi or in Boston or in London. Part of the problem is that it's not a problem, but part of the reason is that we are already working with the most vulnerable, and these are likely the people most affected, who are going to be most affected by climate change as well. So we are already working with the people who will be affected by climate change, and even though we expect that their vulnerabilities will increase as their ability to adapt to the exposure to climate change is very low. So we do see in some of the poorer parts of the world increasing vulnerabilities and increasing threats to human security as well. I think you have to have, working in public health and humanitarian, in humanitarian work, I think it's more of a, it's a value system that you are a humanitarian not because you work in Africa. You can be a humanitarian wherever you live. It is your ability to understand the lives of others and to at times stand in solidarity with them when they're going through a very difficult time. In public health at large, I really subscribe to the ideas of equity, social justice, etc., because these values underpin all of the work that I've done in public health, whether it is fighting for access to essential medicines or providing care in some remote parts of the world. I think they're all sort of connected to the ideas of that just because you live in a poor part of the world does not mean that you do not have the right to the best medical care or the best health care possible. Humanitarian medicine is not second-hand medicine. It's not about going somewhere and just handing out aspirins and blankets. Humanitarian health is, the challenge of humanitarian health is taking complicated medicine that is practiced in developed countries, taking it to developing countries, but simplifying it to the needs of the people without sacrificing quality. That's a big challenge, and very often what we learn in medical textbooks is just not enough, because very often medical textbooks are written based on knowledge we've gained in developed countries around the world. So operational research, evidence, clinical trials, etc., have played a very big role in improving the quality of humanitarian assistance over the last 40 years or so. So research and evidence is absolutely the basis on which we make decisions on what care to provide and how to provide that care. So it's constantly, we are evaluating the work that we do, and we're constantly trying to improve the quality of care we provide. I mean, evidence, I think, is that whole mindset of really trying to understand what works and what doesn't work, and to use that knowledge to inform policy. I think that's what connects. That's a mindset. But we all know, I mean, even in health, as it is in climate change world, policies, it's all well and good to have the knowledge, and it's all well and good to have the science, but translating that into policy is not always easy. And so that's a lot of hard work is required to translate knowledge into something that brings about change for millions of people around the world. Bold. It's not always easy to speak truth to power. I think there are a lot of forces that stand against, a lot of interests that stand against the kind of policies that need to be put in place for meaningful change to happen, whether it's in public health or in climate change. So IU needs to be bold in the kind of questions they ask, and also ensuring that the people who need to hear those questions and need to hear those answers are also confronted in a very bold way.